please welcome Dr. Marjorie Dixon, who joins us today. Looking stunning, as per usual. You don't do any of your surgeries in that dress, do you?
No, I would try, but they wouldn't let me. I wouldn't be sterile,
should.
You know? It's all good.
You know, we're going to talk about something that comes up a lot, but I do not feel that it is discussed a lot amongst women, and it's postpartum depression. So you've had a baby, things are overwhelming, your world has changed. There is sort of a spectrum of different things that could be happening.
Right.
Might be depression, might be baby blues. Let's talk about the difference between.
Okay, so the baby blues is kind of a milder version of postpartum depression, and also temporally, the time at which it happens is different.
Okay.
So from the first 2 to 3 days after you've had a baby to up until 2 weeks after can be overwhelming. Some places say up to 4 weeks afterwards. It can be overwhelming. Your life has totally changed. You're not sleeping. This thing that's supposed to bring you so much joy, which, you know, it doesn't mean it's not bringing you joy, but it's overwhelming to have another thing to take care of now all the time, 24 hours around the clock. So there's no being awake and sleeping. You could be tired from a really long labor. You could have had things happen during your pregnancy that were overwhelming for you, or you got sick during your pregnancy, had to be on bed rest, and then you give birth, and then you're trying to get back into your regular activity, and then you're caring for someone else. So I think that it's something that people don't discuss enough. We talk a lot now, more about issues of fertility or menstruation or menopause getting hot and miserable, but we don't necessarily talk about postpartum depression being very pervasive. And the blues that I just mentioned, 40 to 80% of women
Have the baby blues.
have the baby blues.
Yeah.
That means if there are 80 women in this room, or 100 women in this room, 80 of them might have had that.
Huge.
So that's huge.
I think there's a real pressure to be like all happy, act happy.
Well, it's supposed to be that happy, lovely, you become a mother, the meaning of life, and it can be. But if it's not, that's pretty normal. Because your life it's life changing, and any big event in your life can manifest itself in you not being able to manage and being overwhelmed. So that's the blues from 2 to 3 days to 2 to 3 weeks. Generally, as you get into a routine and maybe you get some help from the people around you and you're sleeping a little bit more and you're understanding this new human being who requires you so much, you see past it. So really it's you have some changes in mood, you feel kind of lower, you're irritable, you're kind of anxious, you're not sleeping so well, you're tearful,
you cry.
I had it. Like, I remember afterwards, and my poor mother-in-law who came down, so my mother-in-law, my sister-in-law, and her husband, and my partner were all like, the baby was crying, I had a lot of trouble with nursing, and that's what got me. And I was tired, and my breasts hurt, and my nipples were cracked, and I was happy, but I was sad, but I was angry, but I was tired. And I couldn't figure myself out, and they came, they wanted to feed the baby formula. You would have thought they wanted to poison my kid.
I know,
I lost my mind. And this is me always. Like, I'm kind of happy, congenial, whatever. But I got through that at 2 weeks to 3 weeks later. And then I was back to myself, tired, but back to myself. For some women, it happens a little bit later, or it leads into something that lasts much longer. And it's not just kind of feeling tired, anxious, moody, low. This is pervasive mood depressed that's low. You don't necessarily feel hopeful. You feel the things that used to bring you joy don't bring you joy anymore. And then it's also associated with somatic things, like you're not sleeping or you're sleeping a lot, or you're not eating or you're eating a lot. And you have weight loss. And the things that you used to be able to help get you through those, like sometimes chocolate or happy or or friends coming over and wanting to help, and you just not being able to see the light at the end of the tunnel, that's the difference. That's depression.
Okay, that's what I had. I wasn't sure, and I know my midwives had came in and said, you need to get a breast pump, you need to start feeding this baby through a bottle and getting some sleep, because I know when things are wrong, when I don't want to eat. Never happened before in my life.
Oh my gosh.
Oh my gosh, my husband had to cut food into tiny little baby bite-sized pieces and try and feed me. Didn't want it, couldn't see the light at the end of the tunnel.
And that's one of the somatic changes. So you don't necessarily see happiness at the end of it, and the things that used to bring you happiness don't happen, and appetite, sleep, all those kinds of disturbances happen. The main issue is if you get so far into that you don't see any getting out of it, or you start to have push the people away from you. And there are risk factors. When that happens, by the way, the worst case scenario is that you have what we call, you have suicidal ideation, and you think about maybe potentially harming the baby. And it's not anything that people can control. So you're like, oh no, I know that I'm sad and I can figure it out. Once you get depressed, it's medical illness, clinical illness. You need to see a physician, you need to get medication and or cognitive, what we call behavior cognitive psychotherapy. So you meet with someone that starts to teach you to recognize the signs, where you're headed, why you're headed, and to work through it along with medication. So that's worst case scenario.
Right.
There are risk factors for this too, so people need to know this too. So if you have difficulty in a relationship before you have baby and you get moody afterwards, you're at greater risk. If there's family history of depression or mental disorder, like affective disorder, so feeling low or high, you're at risk.
Yeah.
If you have lost a job or your partner has lost a job, you're at risk. If you're a younger mother, a teenage mother, if you are immigrant status. So if you're anywhere where you may be socially isolated and alone, this kind of North American way that we have of you have your baby, you go home, good luck, get them in their car seat, and then you're alone with your insular family is not necessarily how humans were programmed to be. And so having not all of those supports around you and people raising a child together, you know how people say it takes a village, but we don't necessarily have villages.
Right.
So people who are socially isolated, those are risk factors. And then there's also hormonal things. So it could be your thyroid hormone. So that's why it's so important for physicians at that first postpartum visit to talk to the patients and to say, how are you doing? Are you sleeping? Are you eating? Are you feeling like you're low? Or is anything going on? And physicians and healthcare givers have to ask the specific questions. This is what the studies show. So it's not only enough to say, are you feeling okay? But you have to say, have you thought about hurting yourself or your baby? And people will answer it, because people won't volunteer that information.
No.
And that is a psychiatric emergency. If people are thinking those things, then it's not like, okay, well, we'll make an appointment for you to see your family doctor. No, no, no. They need to go to the emergency room and see a physician and be assessed and then maybe admitted and treated.
Right.
So that's depression.
I'll say that's one good thing about a lot of municipalities in Canada. You have services. I know for the midwife services, they actually visit you postpartum every other day.
Yeah.
They help you.
Yeah.
They help you breastfeed, and they were the ones that put me on to the fact that something was wrong.
Yeah, yeah.
Because I remember I wanted to sneak out the bedroom window and, you know, just get away.
Yeah.
Like I just didn't want to deal with it, or leave my baby with the TTC streetcar driver.
Yeah, like,
You know,
like somebody
take it
else.
away.
Yeah, somebody else to take
I
care
can't
of.
do it.
But that's not. It's not that unusual because it is overwhelming. And when
Yeah.
you don't have people around you, some women are amenable to. I was amenable. Anybody want to come take care of my baby? I was good.
Yeah.
Like so, if people offered me help, I would say, yeah, great, come on over. But not everybody has that. We have this need to do it ourselves.
Yeah.
And that's okay, but it can put you at risk of being in that place of darkness.
For
so you
sure.
need to be able to accept help if you can, and if you can't, allow other people to help you to get you to where you can get help.
So the big key is know how to tell the difference between normal postpartum feelings and actual depression. Because if you are heading into depression, you need help.
Yes,
From
absolutely.
an expert.
From an expert.
Okay, good stuff. Great information. Thank you. Let's go to break. More coming up.